Hi there. Are you a nurse who have ever felt embarrassed because you failed to escalate a concern about your client or patient to any member of the multidisciplinary team in a professional way? Do you feel you aren't recognized as an intelligent or a classy nurse? Do not worry. Remember, we are a team and must seek to each other's career success. I encourage you to watch this very video to the end because it seeks to bring to you the best solution to this problem. Hi lovelies, you are warmly welcome back to this channel. If this is the very first time you are seeing me, I am Mami Ajwa, a proud Ghanaian trained midwife. This channel is created to talk about everything or the details about healthcare. Kindly stay tuned as I bring to you a topic known as SBAR, one very important approach to escalating a concern about your patients to a doctor or any member of the healthcare team. This skill actually helps you to give information about your patients in a concise, assertive, and then systematic manner, so you don't tend to give too much or too little details about your clients at a specific point in time. Before I walk you through the video proper, let me first raise a disclaimer as I am going to use a person's name or obviously an age, which has nothing to do with any patient or any specific individual. But then I have to say this because the protection of a patient's privacy is one of our hallmarks. SBAR is an abbreviation where the S stands for situation, B for background, A for assessment, and the R for recommendation. Let's demonstrate this with a patient scenario situation. A nurse or a midwife working in the line-in ward, and you're taking care of a patient named Madam Ajwa Beauty, a 32-year-old multi-gravida para 2, who was admitted into the ward 2 hours later after delivery. According to the birth attendant, she lost about 300 ml of blood only, and her vitals were normal. But then as part of your 15-minute checks, you realize that her vitals is being changed. She feels restless and very anxious. This is a concern that needs the attention of the physician as well. As the vitals that was handed over to you were BP 115/60 millimeters of mercury, pulse was 85 beats per minute, SpO2 was 96. But then now her BP has actually significantly dropped to 90 to 40 millimeters of mercury. Her heart rate is also 120 beats per minute, and her SpO2 is quite considerable, which is 95%. How do you present this case professionally to the doctor for him to also be aware? Firstly, we have to use the approach that I've already spelled out, which is the SBAR. So now let's dive into the details. 1. The situation. All that it entails is that you have to introduce yourself as a nurse, the ward that you are calling from, a brief introduction of your patient, and also the reason for which you are calling. Let's cite an example for this. Hello doctor, good afternoon. This is Nurse Patricia calling from the line-in ward, upper room 2. I am calling to raise a concern about my client, Madam Ajwa Beauty, whose vitals has negatively changed. She's restless and very anxious as well. I think she will need your urgent attention. This ends the situation. Keep it very simple and straightforward here. The background actually creates or paints a clearer picture about your patient. For instance, a date of admission, her past medical history, any drugs or IV fluids that she is on. Is there any lab results that needs the review of the doctor? These are what the background will entail. Okay, so let's present it to our doctor now. Madam Ajwa Beauty, a multiple gravida para 2, was admitted on the 22nd of November, and around 8 a.m. this very morning, she delivered per vaginum without any complications observed. She has no bad medical history. Her drugs that she's taking were the antenatal drugs that she used to take and the added Hematenex that we usually give after. Now let's move on with the assessment. All it has to do with is you talk about the current status of the patient, especially the vitals. You have to actually give the difference, do the comparison between what you had the previous time and the current ones. And 2, what you have done for her to salvage the situation or as a means of resuscitation for the client. Let's get right into it. My biggest concern is with reference to the vitals of the patients, which when I took up were within normal ranges, but unfortunately about 10 minutes ago, the BP, for example, has significantly dropped to 90/40 millimeters of mercury. The pulse is now 120 beats per minute and an SpO2 95. The patient has been served with 2 liters of normal saline via a large bore cannula, and then a prompt assessment and examination has also been carried out, where we can say that patient is actually experiencing postpartum hemorrhage, and the exact cause is the tear of the cervix. The point where the cervix has been torn has actually been clamped with a forceps in order to arrest the bleeding, and also 1 gram tranexamic acid has been served. Grouping and cross-matching has also been carried out, and then 1 unit of blood is arranged in order to serve patients with. Currently, she is being monitored 15 minutes continuously, and preparation for theater is ongoing. I bet you, my dear, as at now, the doctor has a full picture of what this patient is going through, and I'm very, very sure that he is on his way to the ward to see what is actually going on, to also give out his best in order to save the situation. Now, let's finish up with the last letter, which is the R, recommendation. What do you have to do at this point in time? You would have to seek that the doctor comes around to see the patient, and secondly, ask if there's anything that he would want you to do before his arrival. Let's also present it. Doctor, I am very concerned about my patient, and I would request that if you can make it right now into the ward to see how far we can help the patient, I'll be very glad. Also, is there anything that you would want me to do before your arrival? Please be sure to ask questions if you don't understand any of the orders that he gives. Do not hesitate to ask if there's anything that he said that you didn't get right, so that you wouldn't end up making a mistake. After that, make sure to complete these orders, and lastly, do well to also document. Without documentation, none of the things that you have done actually stands out, because it means you've done nothing. Documentation has to really end this very process, and it's very important. I hope you've enjoyed this video, and I believe it will be very useful for everyone out there. Please keep practicing it. Watch the video over and over so that it becomes part of you and you will be conversant with it. If there's any topic that you want me to talk about, do not hesitate to write it in the comment section, and sure, I'll be there for you. Subscribe to this channel. Do well to hit on the bell, share with friends, and also comment. Thank you so much for coming back. Until next time, bye.